The eye is like a camera with lenses at the front and the photographic film or retina at the back of the eye. And between the two, in the body of the camera, is a clear jelly called vitreous. This jelly is not of uniform consistency, and usually, even in young and healthy people, there are small clumps of jelly floating around. And these small floaters are normal and quite often seen when you look at a plain surface, such as a white wall, or when looking at a clear blue sky. With the passage of time, however, most of the jelly starts to degenerate and turn into a more watery consistency. And eventually, when sufficient water has formed, the remaining jelly that is normally up against the retina or photographic film at the back of the eye suddenly pulls away and collapses down into smaller lumps of jelly. This is sometimes called a posterior vitreous separation. It usually results in a sudden onset of new floaters not associated with flashing lights, and then with the passage of time the floaters become less problematic as you learn to ignore them, or they float out of the way with gravity. Occasionally, however, if the jelly pulls on the retina and tears the retina, and this is a small number of people, the retinal tear can result in a retinal detachment, where the watery component of the jelly goes underneath the retina and the retina comes away from the back wall of the eye. So if you were to suddenly develop a sudden onset of floaters but with flashing light sensations, that combination of symptoms is very suggestive of retinal tear formation and needs to be seen urgently and treated urgently if a tear has developed to prevent a retinal detachment. Most people, however, with floaters are not associated with such significant problems within the eye. If floaters are very troublesome, there is a treatment called a vitrectomy which removes the jelly from the eye cavity, but this is not without its risks, although the risks these days with the sorts of surgery that are being performed is very low. If patients complain of floaters, one normally suggests observing the situation for a minimum of 6 months to see if the floaters improve with the passage of time. But if floaters are still quite troublesome after this period of time has elapsed, then an operation called a vitrectomy to remove the jelly can be performed, usually very successfully.